Hello everyone, sitting at home during this COVID shutdown. I'm going to create a video illustrating a 2-implant overdenture on a bone-based guide that utilizes 2 fixation pins. So we're going to start by opening a patient file DICOM set of the patient's anatomy. And we can downsize the volume to conserve resources on the computer. You don't want to get rid of your fiducial markers, which you can kind of see highlighted right in the middle there. But you can get rid of some of the posterior anatomy, some of the superior anatomy, and then let it load the data set. Now, it's going to give us the option of bringing in the patient's data, denture, and we will end up choosing the lower option, which is import CT scan of denture or scan appliance with markers. When you do this, you'll have to then navigate to where the denture scan is located, select OK, and then it will load the denture for us. We can similarly decrease the volume, but don't take away any of the denture, which also contains the fiducial markers. Now it will bring you to the section in the software where you can mark the fiducial markers in the patient scan, which is on the upper left. By using the slider at the bottom, you see we were able to eliminate some of the patient's anatomy so that only the fiducial markers show. And now by holding the shift key, our cursor changes to a little plus sign and we can mark the fiducial markers. And this is just telling the computer that these are common points between the patient's anatomy scan on the left and the denture scan on the right. You will notice that one of the markers that was present during the anatomy scan on the left, this one right here, is not present when the denture was scanned. This can be from just getting it knocked loose or it fell off somewhere during the process, so you wouldn't want to mark that one. But then you'll see it'll bring the denture in and align it to the patient's anatomy, and that's the way the denture is oriented in the patient's mouth. Now we can use that information to decide where to put the implants so that they properly project into the denture for the locator housing to be correctly oriented to the patient's denture. Now I'm going to select over to the advanced module, the module implant module advanced mode, so that I have all of my options available for placing the implants. Now I'm going to select an implant and I'm going to use a BioHorizon implant here. So I'll change the family to BioHorizon or the manufacturer to BioHorizon. And then pick the family that you want, which I'm going to use a platform switched implant, and I'm going to do a 3810, and I will drop this implant into the position. You can drop it almost into any one of these screens, but I want it to be proximally in the lateral incisor position. And so I can just click there and it'll drop it on. Now in the cross section or the tangential, I can begin to manipulate that so that my projection line is into the center of the denture. You can see the highlight line of the denture in white above the bone, and I'm using that highlight line to tell me what the projection of the implant is, because that's where the locator will end up sitting. I am going to plan these 2 implants to be parallel and within the confines of the patient's denture. So we're dropping the first implant in, You can see it kind of leans toward the distal. I think I'd rather have my two implants in a straight vertical orientation. So you can move these little widgets around to manipulate the implant here in the 3D image, or I prefer to manipulate them in the tangential. I line the tangential line up, and then as I straighten it, I can watch what's happening down in the 3D image in the lower left, and I can see that now I've got the implant in a more vertical position. Now I can double check it again. You can see it's a little bit lingual, so I just change that rotation ever so slightly, and I can still confirm in the 3D image down in the lower left that it looks like it's a good orientation. That locator housing is going to fit nicely under the denture base and not cause me to have to build out the lingual or the facial or have issues with where the housing needs to sit. At this point, I'm going to duplicate that implant, and if I move the implant in the axial view to the approximate location of the other lateral incisor, the two implants remain parallel to each other. So now both implants are parallel. I can adjust it in the axial view as much as I want, keep them parallel, and I can adjust them in the by moving it. If I rotate it, the parallelism would be off, which I'd have to reparallel. But as you can see, I've got this going into the base of the denture quite nicely. Both implants are parallel. Let's take a look at the implant validation. You see those exclamation points associated with the two implants. And one of the reasons is that we are using BioHorizon implants, and we're not using the exact BioHorizon protocol. So I see that I have a drill kit warning. I fixed that by going to the implant list, changing it from the bio to the custom kit, and now those validation errors will go away. We can also double check that we are parallel by changing the angle, the implant minimum angle, to 0, and you'll see that no exclamation points arise, which indicates that we are in fact parallel. So now this, I would send this entire file, the entire Blue Sky plan file, to Image 3D Conversion, and they would send it back to me with a bone guide in place, properly aligned to the patient's anatomy with the implant still in the plan. So now when I get it back, I can load the file that they returned me. This is the file they returned to me. It's got final at the end of it. They don't modify the original file. They just add the word final at the end. And then this is the original file. So now I can open the file that they sent me, and it will have the bone model in place. You see the brown model is the bone model. The gray is the patient's original anatomy. In a minute we'll turn the gray off and just look at the bone base guide. My two implants are still in the plan, in the position that I originally planned them. We now want to set the parameters for the guide tube that are specific to each implant in your plan. The plan can be customized to any manufacturer and specific implant. Blue Sky has many implant libraries and guided kits built into the software. If you use the settings in the software, be sure to use the Blue Sky guide tubes that you can purchase directly from Blue Sky. Because I started using this software for guided cases long before these libraries and guided kits were available,
I figured out how to design guides using the BioHorizons sleeves, and for that little modification, I used the custom kit setting in the Blue Sky software, which allows me to set my own parameters.
I'm going to go to the implant parameters, and I'm going to set up the parameters for the guide tube. Now I have a form that I use for this. It's an Excel spreadsheet that tells me the diameters of the sleeves that I use. In this particular case, we are using a 5.28 millimeter sleeve, so we will add the tolerance of 0.2 for my printer, and I will put in 5.48 for the guide hole diameter. The height of my sleeve, which is the height of the portion below the printed surface of the guide, is 5.5, and the offset is calculated using the implant length and the drill that I'm going to be using. The offset in this case is 8.5 for this particular implant. Now if I go down and I click on Apply to All, it will apply those settings for the guide tube. Since these two implants are identical, it'll apply these settings to the guide tubes to the other two implants. Now we'll turn off the patient's original anatomy, so you can see that the two guide sleeves clearly do not interfere with the bone in this particular case. So we really don't have to do a bone reduction guide of any sort. We're just going to straightforward lay the flap, place the guide on the bone, and put the implants in. So now we want to design and place two fixation pins. A fixation pin is nothing more than a custom implant. The BioHorizon fixation pin is 25 millimeters long, and it has a 2 millimeter apical and occlusal diameter. So it's basically a 2 millimeter cylinder, 25 millimeters long. I'm going to drop it in. I'm going to place two fixation pins medial to the two implants. So I'm going to drop it in. And now you see the fixation pin is sitting in a random position. I want to go to the implant list and turn the sleeve on so that I can tell which end of the implant of the fixation pin is what the orientation is. And now I'm just going to orient it. I find it easier to begin orienting this in the 3D window, as you see here. So I can begin to position it, and once we get it positioned where it looks generally in a good position, we can check it in the slices to make sure it's where we want it. Okay. You can see by turning off the patient's model of bone that it is not touching the implant, so it's in a good location. And we can look at the slices and make any necessary adjustments. As I move this tangential window into the view, I can see that the lingual is not included. That's because my panoramic setting is not wide enough at this point. So if I just expand the little yellow ring in the axial view, I can now see that it needs to be deeper. I want to place it to where it begins to engage that lingual plate, but of course we don't want to perforate the lingual plate. Barely engaging it will just make for a more stable fixation pin. Okay, so we can look at it in all the dimensions. We can make sure that we're not near the lingual artery and the lingual nerve. and we kind of like that fixation pin in all dimensions. Now the simplest thing to do is to duplicate that fixation pin and move one to the other side so that we have the two fixation pins that we want. And that's what we'll begin to do here in just a second. Before we do that though, I'm going to set up the parameters for the guide sleeve for the fixation pin. And for the BioHorizons fixation pin that I use, this little diagram gives me the information that I need. It has an outer diameter of 3.0, and so I would add the 0.2 tolerance and get 3.2 as my guide hole diameter. It has a height of 2.2 millimeters. That's the portion that's below the printed surface of the guide, and it has a lip of 1.84 millimeters. So if I run the calculations using a 28 millimeter drill to place a 25 millimeter fixation pin, my offset is 1.16 due to the 1.84 millimeter lip height. So I put the 1.16 in here. I can put the 2.2 millimeter height, and it is all set. Like I said, the height is defined as the portion that's below the printed surface of the guide. Okay, so now that all of the parameters are set up for the sleeve, we can go ahead and duplicate that particular fixation pin and move it over. So what I want to do is first turn off my projection lines just so they get out of the way. Now I can find that fixation pin in the axial view. I can duplicate it, and now just grab one of them and slide it over. Now I can begin to orient it, and as I move this over, it'll keep it in the same general plane as the original fixation pin. So you'll see that it comes out to be in a reasonably good projection by using duplication and then moving in the axial plane. So here we go. We're positioning. Now we're going to check it in the slices. If we like that particular position, it avoids the lingual nerve and artery. We are all set to outline the guide and then export the guide. Setting up the parameters for the guide tube on the first implant and then duplicating it, we actually have duplicate those parameters as well, so we don't have to do that twice. Okay, so we've got our two fixation pins in place. We should be now ready to draw the curve and set up the surgical guide. So I like to make this big, and I can begin holding shift allows me to draw the curve for the extent of the surgical guide. And you can make this a little bigger than you think you need it. I'm a big proponent of printing both the brown model, the yellowish brown model you see here, as well as the surgical guide, and then fitting them together so that you can see how the surgery is going to flow. You see, we kind of loop around to avoid the lingual nerve and artery and the junior tubercles, as you see, and then we come down and connect the guide and finish the guide outline. So we're avoiding the lingual nerve and artery, the genial tubercles. I'm going to go ahead, just because it did come up as to how far, where the mental foramen is. I'm going to go ahead and quickly outline the nerves. I just happen to know that the nerves are completely out of the way in this particular case. This is a severely resorbed mandible, and you'll see the mental foramen is actually up on top of the ridge in the posterior segment. And it's far posterior to actually where we are in this particular, with this surgical guide. So we're going to go ahead, I'm just going to mark the two nerves so that you can see them and see exactly how far posterior they are. This is a very crude and rudimentary way of marking the nerve. When I actually do this for a real case, I would be much more careful. This is just to show you that in general the nerve is far out of the way of this particular case, and it's really not coming into play. So now if I show you the nerve by tipping the model down, you can see that's the mental foramen, which is up on top of the ridge. Here again, severely resorbed mandible. Yes, that was painful for the denture and had to be adjusted out of the way when we first delivered the new denture. So here we go. We've got the guide ready to go. We can make some small adjustments. You can make adjustments to wherever you might like. You can see that the guide extends down over the very close to the genial tubercles. You can move these dots up to get it away. But I'm really a big proponent of printing both of these, printing the yellow model and printing the surgical guide, fitting them together, and then you can make some adjustments with an acrylic burr. You can thin the border down. The guides that you get tend to have thick borders. You'll see that in a minute. You can extend it down so that it grabs more bone. Or if you're concerned about having to flap too far, you can move the dots back up to avoid. It's really your personal preference as to how you want to do the surgery. However, I will caution you, make sure you have enough surface for this to fit solidly to the bone so that you don't have a guide that has a sloppy fit. So you have to have enough of a broad base on the bone to make sure that the guide has a stable seating surface. Okay, so now we can generate the surgical guide. And as you'll see, as I stated a minute ago, the guide has a bit of thickness to the edge that can be tapered down with an acrylic burr. It's quite easy to taper that down using an acrylic burr. And I would print both of these two models, the blue surgical guide and the yellowish brown bone model. That way you can fit this together and you can see how these fit together and how it's going to look at surgery and that type of thing, and get a feel for what you're going to feel when you're trying to fit this to the bone surgically. And it's remarkably accurate. The experience you get fitting these two 3D models together is very similar to what it feels like in surgery. If you turn the bone model off, you can see that the two fixation pins are far enough away from the implants to not become a problem. And this guide should work out very well. Okay, I would now export the data. And I'm going to turn everything off except for the bone model and the surgical guide. So we want to turn everything else off. And I want to check the box that says export to separated files into a folder. And when I click export, it's going to charge me for one export to license this file. And now I can save this to my desktop to whatever folder you want to save it to. You can name it according to your wishes. And now, when I find that folder on my desktop, I can open the two individual files and have them printed in the method of whatever your choice is. You can drop these on your own printer, or you can send them to a printer vendor and outsource the printing. But I would print both of those two models so that you can practice your fitting of the two models and do any slight adjustments you want to with an acrylic burr.
Hey, thank you for watching. I hope this has been beneficial. If you have questions or comments, you can email me at drp@drpatedmd.com. I love to teach courses at my office from time to time. These are boutique type courses limited to 10 to 12 participants at most. My passions are guided surgery, data collection and case presentation for the new patient exam. We utilize Excel to organize and streamline the data collection, and then PowerPoint to illustrate the treatment, customizing the presentation using the patient photos obtained during data collection. I also love to discuss digital diagnosis using Exicad. Wow, that's a big topic, but so much fun. If you're interested in any of these topics, I'd love to hear from you, and we can try to set up some time to get you up to speed on your topic of interest. Now, these courses are software intense. I find the biggest roadblock most dentists have to digital dentistry and guided surgery is learning to use the software. So we dive deeply into the software so that you learn the fine points of the digital world. We can initially outsource the 3D printing, and once you know the software, in-office 3D printing is easy to add. We can plan one-day classes, but the most benefit is obtained from at least a 2-day format with any of these topics to become proficient. Have a great day in spite of all this COVID shutdown, and I hope to hear from you soon.